feel like I'm going to burp. Okay. Hopefully that was live. I think we're good now. I'm live. Am I? Don't see am I? Okay. We are live. Fantastic. Hello. We're just going to give folks a couple of seconds to filter in and yeah, but man, this is great. If you were in line to go to the last webinar that Big Tech unfortunately had to cancel, I appreciate your patience for hanging in there. And if this was a better time, then I'm glad that we can make it work for you. All right. Who thinks that they're like the furthest away geographically from where I'm in Las Vegas. So if you live somewhere super cool or unique, like not the United States, go ahead and chime in just so I kind of know who we got. Make sure the chat works. Unless everybody lives in Las Vegas, in which case. Cool. Virginia, heard. It's pretty far. All right. I'm going to give it like 30 seconds more, and then we're just going to roll. We're going to roll through it, and whoever shows. Canada, let's go. Okay, Mom, you're beat. We got a Canadian here. Yeah, my mom's in this. All right. So just to give a basic overview of how this is going to work, have a short little presentation we'll go through about, as the title predicted, low back pain for powerlifters primarily. But then we'll have some time at the very end for Q&A. And, if there are questions that come up during the presentation, please feel free to shout out in the chat. And we'll, excuse me, I'll be happy to kind of like pause and talk as it makes sense and works that way. So without further ado, I think we can go ahead and get rolling. I think it is time. All right. So everybody, welcome. Mike Taylor, Doctor of Physical Therapy, coach with Gifted Performance. Thank you for showing up today on this very nice Thursday evening. Today I'm going to be talking about low back pain for powerlifters. Just have to do a quick little medical legal disclaimer. This is not official medical advice. This is all for educational purposes. Go see your doctor if you got questions. I'm an independent contractor with Gifted Performance LLC. And I also, as an employee of the Department of Defense, have to let you know that this does not represent the Department of Defense, the United States Air Force, the U.S. government, etc. My views and my views alone, not an endorsement, etc. So yeah, we'll keep this short. I'm Mike. I went to Florida State in 2014. If there are any Noles in the chat, go ahead and drop a go Noles. If there are any Gators or Canes, the like exit buttons right there, you can block me. I went to Florida State, graduated in 2014, where I got really interested in powerlifting, fell in love with this sport, and decided that I really wanted to make the human body my life's work. So I went to the Army Baylor program for physical therapy school, and that kind of brings me to where we are today, a physical therapist, as well as a coach with Gifted Performance. With all these balls up in the air, things I'm trying to juggle, I also try to lift myself, recently competed at 110 kgs, and also try to be an adequate father and husband to my wonderful family. So got a lot going on. But that is not why we are here today. No, dear viewer, why we are here today is to talk about back pain. So why are we talking about low back pain, of all things in the first place? So it's common. That's one thing, right? So 7.5% of humans worldwide are experiencing low back pain at any given time. If you have a room full of 100 people, 7.5, if you wanted to cut them in half, right? 7.5 folks are going to be having low back pain at a time. It's disabling. It's the leading cause for years lived with disability, as well as like work days lost to disability, and then incurs a huge medical cost burden as well. Big strain on the healthcare system. And then germane to this presentation is that it affects powerlifters. By far, it is the most common thing that I see in my own practice when I'm talking with lifters. And I personally have dealt with it as well. And I really understand how frustrating and really almost depressing it can be to deal with this for a long time. So who's to blame? We got to figure this out, right? We're going to find the guy who did this. Is it your anatomy? Like, is it a disc? Something like that? It's really not that simple, right? Because what we know is that 96% of young athletes are going to have abnormalities on their MRI findings, meaning whether they have pain or not, there's going to be little things that are going to be imperfect about that MRI. Furthermore, 37% of people without pain, no pain at all, are going to show signs of degradation on their MRI to their discs. So we really can't point to discs as like a smoking gun of if you have disc damage, you're going to have pain, because 37% of people without pain are going to have those issues anyway. Furthermore, we understand that people with these injuries are going to overwhelmingly recover and not need surgery. And that furthermore too, they are able to kind of resorb and heal on their own. So that kind of paints a picture of like, okay, we're taking an MRI picture, a snapshot in time of what the back looks like. It might be associated with pain. It might not. We'll get into like how that could be in a minute. And then the disc bulge could even heal on its own. So really what that tells us is that anatomical causes for pain, super, super unreliable. And we can't put our hat on imaging to really explain the big picture. So it's got to be about technique then, right? Like you flexed your back weird, your hips shifted, your knees caved, something like that you've been told is messed up about your technique has got to be to blame, right? Well, again, not so simple. It turns out that spinal flexion appears to be more or less unavoidable in lifting tasks, even if we're trying to cue a so-called neutral spine. So what that means is that even when we're trying to be neutral, we're not as neutral as we think. And furthermore, too, the evidence doesn't really even suggest that a flex spine or poor technique is even going to be associated with pain or increased injury risks. At the end of the day, what it comes down to is that the way that we feel is more important than the way that we move, and that the way that we actually view our situation, the way that we interpret our pain experience can be much more predictive of a positive or negative outcome than physical factors such as like how much range of motion in your hips you have. Are you able to maintain stability in your spine? Those things are much less reliable. And these technical errors, inevitable. Sometimes things are not going to look picture perfect, but we know that that is okay. And how could all of this be? What are we going to use to explain pain if we don't have all this other information? Well, I think we got to kind of explain pain from like a definition standpoint first. So pain is a noun, and the International Association for the Study of Pain defines it as such. I'll let you kind of read through it as I go through here, but pay attention to that potential piece. An unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. What this means is that pain is not a reflection of damage. Pain is a biopsychological experience that is generated within our brain that has inputs from our anatomy, inputs from mechanics, inputs from the physical side of things, but is that pain picture is painted by our brain, by our psyche. And what that means then is that you don't actually have to have damage to have pain. And this is basically a very rough overview of how we experience what's called nociceptive pain. There are other forms or types of pain that we're not going to get into today, not germane to the discussion. But for today, what we're going to talk about is how nociception, or the stimulus of these like so-called pain receptors, works. So you have these sensors throughout your body, let's say in your knee, for example, or for this case in the low back, right? So these nociceptors are going to detect noxious or painful stimulus, and they're going to send that information further up the chain for processing. If we think about an alarm system, this is almost like the tripwire, the motion detector. All it's doing is just picking up input and sending it on for further processing. Where it gets processed further is at the spinal cord, where this kind of acts almost as like a switchboard. What's happening here is it's determining, are we going to send this signal up to the brain to really be processed further, or can we extinguish this here? And an example of how, you would think, oh, well, if you stub your toe, you're going to feel it no matter what, right? Have you ever thought about people in, say, combat, people in like life or death situations, things like a stubbed toe, not important for our survival. being able to, stay alert, being able to return fire, for example, things like that, important for your survival. So it's possible that you might not feel every piece of nociception. You might not get that stimulus all the way up to the brain because it's not relevant or important. And the spinal cord is receiving this inhibition from the brain to, hey, we're busy right now. Don't press it on up. Or sometimes it'll be determined, hey, we need this information, send it on up the chain, where it gets to the brain or the control room. And this is where all of your thoughts, this is where you your lived experiences kind of color this picture and create your pain experience, as it were. The brain has a massive, massive, massive role in how we experience pain. And is really kind of at the core of what we call the biopsychosocial model for explaining pain. Whereas sometimes we like to think of pain in this purely biomechanical model. We have pain in our back. That means that something must be tight, something must be weak. There must be some sort of physical factor that is to be blamed for this. The biopsychosocial, model instead asserts that our psychology, our social interactions, all of these things have a massive role in how we experience it as well. So things like what we expect, sometimes we might expect hey, I tweaked my back. I expect that this is going to be very painful, very debilitating, have potentially a lasting impact on my ability to exercise, ability to have meaningful relationships with my friends and family. Is it going to affect my work? Am I not going to be able to bring home a paycheck? All of these things can play into how we experience pain. So it's not that we can just extinguish pain by just thinking about, sunshine and bunny rabbits and, the 2013 Florida State Seminoles or anything like that. It doesn't work like that. However, when we think about, or when we view the world through, rose-colored glasses versus, tinted glasses that are dark, it can certainly affect the outcome of that pain experience and what we feel. This is really important. We'll get to why. This is why. What happens when we are confronted with pain matters. So let's say you tweak your back in the gym, you're deadlifting, ouch, who all's been there before? I know I have. You tweak your back, we're having this pain experience. All of your lived, experiences up to that point, your beliefs, your expectations, your fears, etc., are all playing into that pain experience, right? And again, we can't just turn it off because we think, oh, it's fine. It's all my brain. It's okay. It doesn't work like that. However, if we then ramp ourselves up thinking about the worst possible case scenario, we start to fear the pain as it comes on because we're thinking, oh my God, is my disc getting squeezed like a jelly donut right now? Was it the way that I lifted this weight wrong? I heard that I was supposed to lift with a neutral spine and I wasn't neutral. What am I supposed to do? You get all spun up. You start getting anxious. And when you start getting anxious, your nervous system is kind of in overdrive. And when it's in overdrive, it starts to get more sensitive. And it's almost as though we're increasing the sensitivity of that tripwire. It's like we're increasing the sensitivity of that switchboard. So now when the spinal cord is getting that signal hey, nociception here, what's up? Whereas previously it maybe would take a certain threshold to achieve, okay, you can go on up to the brain. Now it takes less. We're more sensitive. So now, perhaps maybe it's just the sensation of stretch. That association is enough to sort of trigger that and sort of generate that pain experience, as it were. So it basically then leads to this cycle of disuse and disability. The more that we are avoiding, the more that we're staying away from this, the more sensitive we get. And it kind of comes to a point where we can only take away so much, right? So you can see the problem. That's why really the backbone of my approach to treating low back pain with powerlifters or with anybody is to approach it with low fear, confronting head on, utilizing positive coping mechanisms, as that lets us break out of that cycle of fear, of hypervigilance, of apprehension, and approaching it with a more nuanced understanding of hey, when I'm deadlifting, my back is flexing, and I understand that that is not a cause for pain. I understand that my discs are going to do what discs do, and that's not necessarily a cause for pain, and that I don't necessarily have to worry about all this crap that I've been told I need to worry about. And if you really let that message sink in, and it does take time, I think it's massively freeing to be unburdened by these expectations of these false paradigms and beliefs that are, unfortunately really parroted throughout popular culture, and especially within fitness culture. And here's the good news. So before I get that, if anybody's having questions, if anybody's having issues, if you haven't been able to hear me this whole time, please speak up. But here's the good news. there's a lot of room for optimism. These are two key facts that kind of give me hope and kind of keep me going. So 90% of individuals with acute or new episodes of low back pain are going to experience resolution within about 6 weeks. We found that to be true. So basically, if I hurt my back yesterday, deadlifting, doing whatever, I should expect that within 6 weeks, whether I sat on my butt and played PS5, or if I, undertook the most rigorous low back pain rehabilitation program possible, that more than likely I'm going to improve. That's hugely encouraging. And in fact, since last week when I had the tech failure, I actually read a new article that maybe even gives us even more room for optimism. And what they found in this study was that really like 6 weeks is maybe even pushing it, and that what we're seeing actually is like a median of 5 days in adults, right? So like then we should be thinking that like, hey, this acute low back pain thing is not going to be my life. This is not going to be my new reality forever. This is just a temporary short-term bump in the road. So it's important then to view it that way, to not get overwhelmed, to get spun up. Again, we start sort of entering that cycle of fear avoidance, of hypervigilance, thinking about, hey, I believe that this should improve shortly. What are some things that I can do to make the time pass by in a way that is more tolerable? That's the approach that we should take. And then two, another reason for optimism is that we know that exercise is an effective treatment option for low back pain, and that it actually doesn't even matter what type. That's the beauty of this here is I'm talking to people who are interested in this for powerlifting. If I was a Pilates guy, if I was a yoga guy, if I was a big runner, I could say the same about all of those forms of exercise. There's not one type that turns out to be better. It's just that exercising, getting people involved in an active pursuit, especially something that involves some like social interaction, getting, out and about in their community and reinforcing positive relationships with the people around them is really helpful and may help to prevent future occurrences of low back pain too. So basically, new low back pain should go away shortly. So we shouldn't spin ourselves up and get freaked out. And then two, if we've had low back pain, getting involved in an exercise plan can probably help to treat it and maybe even help to make the future better. So we have a lot of room for optimism here, and these are two facts that you should absolutely latch onto. So to recap, before we move on, we know that low back pain is a big issue. It's something that affects a lot of people. We know that anatomical causes of pain aren't 100% reliable. We know that technique and mechanical imperfection is more or less inevitable, and my face might be covering this part, but pain is influenced by many other factors. So those are 4 main things to sort of keep in mind as we move forward. And where do we go from here, you might ask? We got to find a way, and we got to keep on going. And this is a massive opportunity to get creative, to find things that are meaningful to the individual, as the doing is the fixing. We'll move on here. So before I talk about prescribing and modifying training for low back pain and powerlifters and active individuals, do we have any questions so far? Everybody doing good? Take a little sip of my spicy water. All right. So let's talk modifying training. So I'm going to kind of break it down as simple as I can. The first thing you want to do is you want to take a full inventory of everything that you got. Painful, not painful, limited, unlimited, everything. So, for a lot of times for people with low back pain, we'll say, okay, it's, I'm squatting, my deadlifting motions, maybe like back movements are painful. Oftentimes bench, upper body exercises. Thank you, Jake. Oftentimes all these other exercises are unaffected. So we want to take a full inventory of kind of what we got going on and take note of the things that are affected, because what we want to do is we want to pull the painful ones back to a tolerable level. So an easy way of looking at this would be, if I can squat 400 pounds, but it starts hurting at about, 300 pounds. Well, you have between 0 and, 299 pounds to work with. You want to take note of what those parameters are, because that's kind of the zone that we want to start training in. And we'll kind of get into more specifics as to like how you can actually do this in a minute here. The unaffected ones, you want to keep pushing hard. Like, why would you stop? I will make a note though, that just because something doesn't hurt, like, okay, you have a low back injury, squatting and deadlifting are maybe a little bit down lately, that definitely doesn't mean go bench all the time. I've definitely made this mistake before, and, I've hurt my back and then just decide I'm going to run small up junior, 6 times concurrently in a row. and your bench will get a little bit stronger. But the problem is that then I hurt my upper body too. So it's like, okay, we got to kind of keep a measured approach here. It's very, very important. So you push the unaffected ones harder as normal. And then gradually, as that symptom severity, your sensitivity kind of goes down, your tolerance and capacity to stress improves and goes up, which is a natural response to training, by the way. You start to just increase the amount that you're doing. And just over time, you start doing more and more of the thing that you used to love doing until you're doing it. And essentially, at its core, that's really it. There are no secrets. So when we're looking at like how to pick exercises to use, you kind of want to pick the movement that is going to be as specific as you can get and maintain a good training effect while also keeping tolerance good. So what I mean by this is, again, going back to that squat example, let's say that you're just like a 400-pound squatter normally, and that you have pain back squatting. Let's say it's like 300 is even too extreme. Let's say that by the time you get up to like 185, 225, which, if you're doing the math here, is about 50% of your 1 rep max. If at that point, your back pain is really starting to flare up. You could certainly, you say, okay, I'm going to keep comp squatting. I'm going to keep doing the specific movement that bothers me, because as powerlifters, we squat, we bench, we deadlift. That's the way that you want to train to get good at those things. If the squat is impacted to the point that really the amount that we're loading is not having a desirable training effect, we're not getting stronger, we're not getting more jacked, we're not getting better at the lift, it's kind of questionable even how specific that is. So, in that case, perhaps instead of choosing a competition squat at such a low intensity to be tolerated, perhaps then you think about other alternatives, which we'll go over in a minute here. So for example, when we're looking at the squats, you could think about doing an alternate bar placement. If you're a low bar squatter, you go high bar. You think about including a tempo or a pause to decrease the amount of absolute load that you can handle. You could use some range of motion restraints as well, using things like a pin or staying to a box, or you could even go even further away down that specificity range, which may improve your tolerance and let you actually train hard, but probably not be as good a vehicle for getting good at squatting, right? There's not a one size fits all answer here. So for example, let's say that you kind of go through this process and you find that you can squat with a safety squat bar with, a meaningful load and meaningful volume. That's good. That's a good option because it's going to be certainly better than doing nothing. It's definitely going to be better than just doing goblet squats or just leg press, etc. But, it's probably not going to get you there alone. So over time, you want to think about your transition plan back to competition squatting, kind of going up the list in terms of what's more specific as your tolerance to that training improves. If you're doing higher frequency, like, if you're squatting more than once a week, which oftentimes many powerlifters are, we can kind of get creative in our approach here. So like potentially you use a tempo squat instead of that safety squat bar on one day. And while you maybe can't use as much load, maybe then on the other day, on your secondary day, you just absolutely blast your face off with the belt squat and you just go complete nuclear on it. And, that's sort of like your main stimulus from like a growth perspective. So I think like both options are good. It's just a matter of what works for you. The whole point is, you don't want to be jamming a square peg into a round hole. That's kind of the main thing that we want to avoid. So if competition squatting with a meaningful load is not working because it hurts, you got to decrease the stimulus somehow. That could be through weight. That could be through any of these other means that we've discussed here. And we'll talk about some more in a minute. And then, overall, the way that we're actually adapting to training doesn't change, right? So progressive overload and then using graded exposure / graded exercise are essentially the nuts and bolts of how this whole thing works. So as long as we are leaning forward into our training and trying hard, progressive overload kind of just happens on its own. We don't necessarily have to program in, a slightly heavier cow every single day. If we're getting stronger, we're going to improve. We're going to have to lift heavier weights to keep getting stronger, essentially. So it's sort of like a chicken or the egg sort of discussion there. So we're starting with something tolerable when it comes to graded exposure and exercise and building up gradually, kind of walking the dog backwards from our goal exercise, be that, competition squatting at 1 rep max type of intensities. We reduce the load, we reduce the range of motion, we change the exercise up. We do something to make the stimulus tolerable so that then we can kind of build on it. We expose ourselves, our nervous system really to that stimulus. Our nervous system reacts, responds, and adapts. And over time, that sensitivity decreases. So it's like we're simultaneously training our muscles, tendons, bones, and joints, as well as our nervous system. And that's sort of the way that we approach these pain problems in training. And so now we're going to go over just some very specific, like movement specific options that you could incorporate if you were dealing with pain in any of the competition lifts, and kind of my thoughts on them. So for the squat, I think one of the simplest things that you could do is simply just messing around with the bar placement. So again, a lot of powerlifters are going to use a low bar squat, which is where the bar is resting on your rear delts versus on your upper traps. As you can see from the illustration here, that's going to result in you being a bit more leaned forward, which is going to put a bit more strain on the lower back and hips. Simply putting the bar on your upper traps, that could be, with a high bar squat, a front squat, where it's resting on your clavicle as well, could potentially be a good option for loading the knee extensors, your quads a bit more versus your back. And if you find that that is helpful, that's about as close, especially with the high bar, that's about as close to competition squatting as you could get, and makes a very, very viable route for keeping the training stimulus high as well as specific. The other thing that I like about a lot of these variations, these modifications that you can make in your training, is that none of them involve crazy cueing. None of them are telling you to squat with pushing the floor apart, or, make sure your knees don't collapse, or anything crazy like that. It's all about hey, we've changed the parameters of the movement by placing the load on a different spot. More or less, you have to keep the bar over your midfoot or you're going to fall over. Figure it out. And then your body just kind of does it on its own. We don't have to overcomplicate this process. Again, we talked about tempo and pauses a little bit earlier, but what I like about that is it does force you to take some weight off the bar, but still can keep the effort relatively high, because you have to control the load in the whole of the squat, as well as potentially doing a slow eccentric or a slow concentric. It just makes your time under tension greater and can actually increase the relative intensity while keeping absolute intensity lower. So for that individual who, say, 400-pound squatter, can only squat 300 pounds. Well, if you can squat 300 pounds with tempo, that's essentially going to increase the training effect of that 300 pounds. So it's a little bit of a life hack there. Range of motion constraints are also awesome as well, depending on the individual and what's going on. As you start to see, we are losing a bit of specificity with some of these, as we're not going all the way down to that range of motion, but sometimes that's what it takes. So you could use a pin squat, where the bar is actually resting on the pins, or you could squat down to a box. Either of these are going to be fine. It all depends on, again, the individual. And what I've listed here are just some variations I like to use, kind of on a continuum of what I deem to be more specific or less specific. There's no rules here, though. Ultimately, it's what makes sense, and it's what works for the lifter themselves. I will say, just one little plug before we move on. I think leg press, hack squat, just bodybuilding type leg movements are kind of maybe not as badly as it used to be. A little underappreciated when it comes to training, and especially for rehab. If you think about somebody, I would much rather somebody just be leg pressing their face off, not having back pain, getting stronger legs, than doing sub 50% squats with a band around their knees because they heard that that's supposed to help them activate stuff, which isn't true. It doesn't actually help. It's all about stimulus. So you want to think about ways to continue getting that stimulus. And, if we got to be a little less specific, so be it. There will come a time when we get more specific. It's all about, again, not forcing a square peg into a round hole. And so we'll talk some about bench. I left this a bit shorter because, usually with people with low back pain, the bench is not a major problem. I will point out, though, that your foot positioning can make a big impact on, how much arch you get and how much force pressure, you're pushing through your lower back. So as you can see in the individual on the left, feet are a bit more underneath her, which causes her to have to tilt forward a bit more extension through the spine. Whereas, the gentleman here on the right, with his feet further out in front of them, he is arching a tad, but still just not quite as lordotic or curved to the spine. So one is not better than the other. I just say this because if, say, benching with a really aggressive arch is problematic, is painful for you, that you might find using your feet out in front of you, even lifting them up entirely, could potentially be helpful as a means of continuing to train your upper body. Then we'll talk about the deadlift, everybody's favorite, right? So I think one major thing that you could do is just train your opposite stance. If you're a sumo puller, try conventional. No guarantees that it feels better, but it might. And if that lets you continue training again meaningfully, then it's worth it. Range of motion constraints are really positive here as well. I think that the block pull is not my favorite, to be honest, because it does sort of change the dynamics of the lift a bit more than, say, like a box squat, because essentially you have to break the bar, you have to break that inertia, and when that happens is at a different part of the movement than, say, when you're squatting with a weight on your back. So what I really do prefer, especially for conventional pullers, doing a Romanian deadlift where you're starting from the pins, walking it out, and you essentially can just kind of control the range of motion as far down as you feel comfortable. You don't have to get all the way down to your shins. You go to knee level, mid-thigh, but this is a good way of loading a hinging pattern earlier in rehab, which can kind of help to get us access to those deadlift movements again sooner. And again, some variations, things that I like to think about in terms of, more specific versus less specific. I might be wrong. Like they're not, this is not a true false dichotomous kind of thing. This is just sort of the rundown that I go through when I'm working with somebody with pain. I'm going to recommend a Romanian deadlift before a glute bridge. And that's just me, but your mileage may vary. So we got all that background now. We understand, here are some things that you could do to apply to your training, some options that you have in terms of ways that you could kind of start training again, which is the big thing, right? Because we understand that, hey, if I tweaked my back yesterday, I should expect that this is going to get better in 5 days and 6 weeks, somewhere in that range. If it's something that's been going on for a longer time, you understand that, hey, it might take some time to kind of get the things moving again, get the wheels turning. However, exercising is important. So the whole idea here is we're trying to find ways to make it tolerable and, hopefully enjoyable as well. So let's talk about how to navigate a setback or flare-up, because I will say they are not necessarily inevitable, but pretty common. And I think it's a major hurdle that a lot of people encounter is, they have this thing happen to them. It was, oftentimes pretty traumatic, but then they get past it. They start getting some momentum. They're feeling good. And then it happens again. And it's like, oh my God, the world is falling down around them. I see it all the time. And I think that the ability to sort of not blink when that stuff happens is hugely important and can be a big difference in terms of how the rest of the rehab goes, because oftentimes it gets better much faster this time than the first time around. So big things that I really emphasize here is, one, just staying calm, remembering that we don't want to throw ourselves into a tizzy over this, recognizing that this stuff does happen and we got to stay with it. So stay with the pain, stay with the frustration, recognize that it's going to get better. And then you're just going to kind of retrace your steps. You're going to take the same exact approach that you took before. You're just going to walk backwards again. If you would, progress to the point that you were doing Romanian deadlifts with 200 pounds and now you can't, well, hey, can I do it with 100 pounds? Start back there. It is okay. It does not mean that the whole program is ruined. It does not mean that that is your new reality. All that it means is that that's where you're at today. Auto-regulating and not being beholden to what you've written down in your notebook, what your training sheet says, is so massively important. And then just reminding yourself that it's going to be faster. It's going to be better this time around. You also have this whole base of experience. You understand the process for rehabbing your low back now. So you understand the things that you have to go through. You know what to expect, and you know that you can get better. So remember that and expect that it will. And if nothing else too, I think remembering that you're not going to lose your gains by not training hard for a little while. So they found that you could just straight up not train for 2 to 4 weeks, and that's not going to radically reduce your strength levels. It can certainly affect your ability to express skill, to be skilled in the movements. So I'm not saying it's not going to affect your 1 rep max, right? But you're going to remain strong for several weeks, even if you did nothing. But we can even maintain for a lot longer if we do some training. And that's where all the things we've talked about already have kind of come into play. So recognizing it hey, if I have to miss one squat day where I'm doing, a goblet squat to a box while my friends are doing, testing their maxes that day, even though it's sucks and it's boring, it's okay. You can expect that it's going to get better. And then what this key takeaway says, I recognize that my face is covering it, is that you can afford to take a step back, address the issue without setting it back long term, and that you're probably going to come out ahead. So kind of recognizing that this is not a sprint, Rather, it's a marathon. So the things that you do now can set you up for the future. So you can either decide like, hey, I'm going to deal with this situation now versus, spinning your wheels, like running into the same roadblock, the same hurdle over and over and over again. So now we're going to do a brief little case study, and then we'll be opening it up for questions. So this is Tom. Hi, Tom. What's up, dude? So Tom's 28, and he loves powerlifting. Tom's basically like every 20-something-year-old dude that I've ever talked to with low back pain. About 6 years ago, he hurt himself deadlifting, and things have just like not been good since. He will make some progress, and then inevitably he'll flare back up again, and it's just been this whole cycle of frustration, and he's feeling really defeated. So he's tried doing all of the stuff that the internet says that he should do. He's tried perfecting his technique. It didn't help. He's gotten the x-rays, the MRIs. He saw that he had some degeneration in his spine. It just kind of made him feel bad. His doctor didn't look up from his computer the whole time. He's like, yeah, you shouldn't lift. It's bad for you. All right, see ya. And he's just afraid now. He's afraid. He's overwhelmed with all this information and kind of doesn't know where to go. If this sounds like familiar, it's because it straight up was me for like the longest time, by the way. But, thankfully for Tom watched this presentation and he began applying what he learned. So he stopped worrying about having optimal technique because he knows that it doesn't matter. That, as long as he is training efficiently, as long as he is, that's my cat. He stopped worrying about technique. He stopped worrying about trying to make sure his back wasn't rounding, etc., because he recognizes that it is not correlated with the development of pain. He accepted the fact that his MRI is not perfect. It's a snapshot in time of how his back looks at that moment. The discs may heal. The degeneration in his spine probably isn't because he's 28 and it's only going to, not get worse. It's only going to progress as he ages. But that's because he understands now that those are age-related changes that are normal and are commonly seen on these imaging studies. And then he reminded himself that, the pain is not a perfect reflection of an injury that's taken place. It's not like every time I feel the pain, it's like my back stabbing my disc with a knife or anything like that. He recognizes that it's a reflection of tissue sensitivity as well, and that all these other factors, thinking back to the things that made him feel so discouraged and negative about the situation, might be affecting him too. And he decided that it was just time to get back to it again. And this is how he approached it. So with that mental foundation in place, he finally felt kind of empowered and sort of like, hey, I have control of my own destiny here. I can do this. That's the first step. So he started light and slow and made modest progressions at first. And I'll even get more granular here. So, let's say he hasn't deadlifted in 6 months. This guy started doing RDLs with the bar to like mid-thigh. And it didn't feel great, but it didn't cause him to flare up too bad. So that was the starting point. In the first couple of workouts, he added 10 pounds per workout, right? And that was the way it went until he started learning that, hey, I've added 10 pounds for like 3 weeks now and it's not bothering me. So he started to make bigger progressions because he felt more confident, felt more assured of what he was doing. He picked exercises that he tolerated well, and he progressed to ones that he didn't previously tolerate well over time. So for him, he could do that RDL. He could not pull from the floor. As he got better with the Romanian deadlift, started to increase the weight, he started to find that he could tolerate pulling from the ground a little bit. He started with, doing like say a block pull and then gradually decreased the height of the block to get closer to the floor over time. And he used a similar approach with his squat. At the same time, trained his upper body and, tried to go after that, 3-plate bench that everybody wants and did that more or less unencumbered. And the big thing is that he stuck with it and he didn't let the flare-ups cause him to fall off the wagon when they happened. And they did happen a couple of times. But, every time that happened, he would retrace his steps, get a workout in, and would find himself quickly back where he was before or even beyond it. And so now Tom's back to hitting PRs again. He's crushing it. He understands that pain is a normal human experience and not something that he has to avoid at all costs. It's something that he needs to punish himself for experiencing. He now modifies his training when pain does recur so that he can maximize what he can do that day. I never said that you'd be perfect, right? Like he had back pain for 6 years. Some days his back hurts and what he has to do is just modify that session so that he gets the most out of it and he comes back and hits it hard the next time. And he focuses on things that are, again, within his control and doesn't dwell on what isn't. He's not focused on making sure that he doesn't lose control of his spine into flexion. He's not worried about making sure that he does the right exercises as prehab beforehand, or making sure his knees don't collapse. He's not worried about that stuff because he understands that it doesn't matter, and he does understand he has a great feel for the things that do. And the end result, he's stronger, he's happier, he's crushing it. And this is the sort of transformation that I hope that anybody here who's dealing with low back pain or has dealt with low back pain before can experience as well. And it's one that I personally have experienced. So I do believe, I know for a fact that it is out there, it is possible. So in closing, this is it's complex and messy. I oversimplify it a little bit at times, but there's a lot that goes into it. You have this whole biopsychosocial model of pain, our nervous system, et cetera. A lot of really complex stuff that goes into the pain experience. And there's no one answer. I wish I could just say just do RDLs and glute bridges. That's the answer to low back pain. It isn't. However, the fact that there's no one answer creates this massive opportunity where you could kind of make the answer whatever you want it to be, as long as it's something that you enjoy, something that's meaningful to you. So if we shift our focus away from these theoretical ideals, back pain's due to I didn't stretch enough, or back pain's due to, my movement wasn't perfect, or, my discs, and just focus on things that we can control, like being patient, being consistent, and setting realistic expectations for what we can do. It opens up your opportunities so much. And if we can embrace the principles of progressive overload and great exposure and exercise, I believe that the sky is truly the limit. So with that, I'm going to open it up to questions. I did want to go to this slide because if you scan that QR code, you can get access to the Return to Training Quick Start, which is my PDF guide. It's about 10 pages or 10 steps that kind of follow the steps that you should take if you experience low back pain in training, or any pain for that matter. Just kind of big picture, what you should do to help go from, ow, I hurt, I don't know what I should do next, to then doing it and getting better. So if you scan that code, you can get that just sent to your inbox. And I hope you enjoy it. So with that, I'm going to open it up to questions now. Make them good. Make them good. Watching the chat on my phone. Perfect. We got the link to download it posted in the chat as well, so you can just go there if you'd like. Thank you, Jake. Everybody snap your fingers for Jake. He's just the wonder boy. He does all of the stuff. I would not be able to put on a live stream or log onto a computer without this guy. So thank you, Jake, for making sure that we could put this together. So any questions? This is y'all's opportunity to get whatever you want. Okay. From my mom, she asked, what about pain from sitting too much at a desk job? I don't want to get a standing desk because I also have bad knees. This is a good point. Yeah, so do I think that okay, I guess let me kind of rephrase the question to then get my answer. So I don't necessarily agree with the idea that some people say sitting is the new smoking, sitting is bad for your back, etc. I think what we find is that oftentimes people, maybe if they sit too much, or if they, even standing too much, it's the being in one position for too long that really starts to get people. And the reason for that is biological if we think about it. So, excuse me. I'm going to cough. Sorry. The reason for this is biological. So when I was in PT school, one of the big things they taught us was how to, move patients around when they're in bed because they're weak or debilitated. And the reason that's important is because if they don't move, you're legitimately going to develop sores on your body that will get infected, and then you die. And then similarly, there's no part of our metabolisms that really is optimal when we're just sitting still. When we're moving, our blood is pumping more, we're kind of flushing or doing fluid exchange, etc. So there's a lot of benefits to being mobile. And what I find sometimes is that, especially with an individual who is, say bending forward too much, or not too much, but if bending forward too much or flexing the spine is problematic, sitting for too long kind of mimics that same action and can be a symptomatic factor. So my answer to that is not, okay, I should only stand. That's something I see all the time. It's like, well, I got a standing desk and I only stand and that's all I do. But like, that's insane to me, in my opinion. I think that's like totally crazy, especially, yeah, you have bad knees. That's no good. So what I recommend is, sometimes some people really like the variable desks. You can do like, the sit for a little bit, stand for a little bit. For me, like I've been sitting here for about 45 minutes now, and it's not necessarily that my back hurts, but like, my hips are talking to me. My back is a little bit stiff. And what I know is that, hey, I need to get up and probably move around. So in a little bit, I'm going to get up and, walk downstairs and play with my daughter for a while. And so the way that I approach it is not like one position is bad and one position is good. Rather, your next position is the best position. So thinking about, hey, if my back starts hurting at like, let's say 45 minutes, then I know that about like by minute 40, I need to start planning like, hey, what am I going to do to take a break? And over time, you can kind of stretch the limits. But, unfortunately, modern society is what it is. And, we got to sit at desks and, sit in our cars and stuff like that. So there might be some inevitability to it. I don't recommend that we have to like totally disavow sitting, I guess. Hopefully that answers the question. And thank you for asking. All right, Matt from Canada says, do you like to use exercises to build up tolerance to the effective position? Example being like flexing intolerant people using Jefferson curls or KOT work for knee pain, of course, dosing load appropriately. Definitely emphasis on dosing load appropriately. Thanks for the question, Matt. So I do. And I think that there's like benefits to doing this as well as benefits to kind of like avoiding the susceptible or maybe like, I don't want to use the word injured or sensitive, I guess. Yeah, like maybe the sensitive range of motion or sensitive area. Because we like I said, we want to like maintain a positive training effect, right? So that's where it's like, okay, if it hurts to deadlift and we want to deadlift, if that's part of our goal, we need to find some way of, hinging the hips forward. And like, you could do Jefferson curls to an extent. My one rub with say like a Jefferson curl or some of the knees over toes stuff is just that like, I think we're so limited in terms of how much you can load it because it is such like an extreme in terms of ranges of motion that like you're more than likely not going to encounter in the thing that you're actually wanting to do. Like, for me with deadlifting, excuse me, if I'm deadlifting, I get into like a Jefferson curl position, like, and it's anything above say like, 50% for me. I don't know. I mean, maybe 50% is a not a good estimate. At any rate, it's not going to be an effective way for me to pull that weight. So obviously I practice the way that I play, which is I want to play to my best. So I use a technique that lets me, brace well, create a lot of pressure and tension and, lift the weight ultimately. I use the Jefferson curl oftentimes more to like help to desensitize people who are legitimately like afraid of flexing their spine. And what I'll do with it sometimes is, again, starting really, really light. And the reason that I like it is because I find that, when people are maybe sensitive to too much flexion, kind of giving the muscles, giving your core something to kind of pull against, some like resistance, it almost creates like a proprioceptive input, right? So like, where you are in space because you understand you have this weight in front of you and you're pulling it up. You're kind of like unraveling at the spine and pulling it back up. I find that can almost like help to access that range of motion via desensitization more than like actually training the structures. Although I'm sure at a point you do start to get some training effect to the smaller muscles of the low back as well as, like the ligaments, etc. So yeah, I do. And like, I definitely think that like, when I'm talking about like knees specifically, a lot of like the knees over toes philosophy in terms of like having like progressions, regressions is like huge. And that's absolutely a major factor, a major thing that I'm influenced by when it comes to, how I prescribe training for people with injuries. Great question. What else we got? And thanks, Jake. Saw your comment too. Any other questions? So we got Matt. So maybe better used for more like psychologically limited people, or maybe for an analgesic effect prior to our specific work. Yeah, exactly. And who's to say that potentially it could actually be great, right? Like I'm not saying that you can't do it. It's just like, to me, if I'm getting to the point where I'm able to Jefferson curl, like a substantial load, I should probably just be deadlifting at that point, is the way that I look at it. I think there's probably just like better uses of my time and my recovery resources than Jefferson curling. But yeah, I think it can be effective, especially like, if somebody's just like scared to bits of it, doing things that kind of force you to get into that range of motion through other means, whether that's, with a little bit of like external loading or with like, doing like, say, like an isometric perhaps can be helpful. Another little hack I'll give you is like if flexion specifically is painful, sometimes like having people do like a seated Jefferson curl, if you will, with like a light weight, where like they're basically sitting at the edge of like a high bench or a table or something like that, can kind of be nice, because then you have like this like foundation that your hips are on, right? So you're not just like drifting your hips back. You have the table or the bench, whatever you're sitting on, is also a constraint, and also kind of provides that input that like, hey, this is where I am in space. It just kind of help people feel a bit more secure. I find, anecdotally, not citing research here, but yeah, those are absolutely things that I would experiment with. Thank you for asking. Hang out for a few more minutes. Let's give it till, I'm in the West Coast, so I'll give it till 6:22. And if I don't have more questions at 6:22, we can sign off and go our separate ways. But I'm also happy to answer questions as long as they keep coming in. Oh, look at that. It is 6:22. Going once. Going twice. All right, sold. If there are any questions that somebody is feverishly typing away at, you can see my contact information is here. Please feel free just to pass it on there, and I'd be happy to get back with you personally. Again, please remember to go check out the Return to Training Quick Start. It's my kind of all-encompassing quick guide to help you get back to training. And again, if I can leave you with anything, it is just to take a optimistic and kind of measured approach to this stuff, focusing on the stuff that we can control, not getting overwhelmed with the things that we can't, because at the end of the day, you have one life and you should do the things that you want to do with it, whether that's powerlifting, whether that's whatever. You should not be limited by imaginary things that don't matter and only hold you back. If there's one thing that you leave with today, I hope it's that. So thank you, y'all. I appreciate y'all stopping by and checking in. Hopefully we'll do this again sometime soon. So this is Mike Taylor signing off.